Hey y'all, Liz here. Welcome to my philosophy of nursing presentation. First, let's start with the evolution of my why. In first quarter, I defined nursing as a promise to provide individualized care so that only the best outcomes result. My philosophy was to promote whole body health by valuing patients' unique personality, culture, and interpretation of the circumstances that place them in my care. However, through nursing school, as I spent time with my patients, I began to see that their feelings and emotions were often neglected. The negative emotional outcomes I witnessed were not unlike those I have experienced as a patient. Due to my extensive medical history and diagnoses, I have spent more time at the doctors or in the hospital than the average person. I have experienced interactions with nursing staff that left me feeling like a huge burden, like I was stupid, shameful for the healthcare decisions I was making. I left feeling weak, small, insignificant, and like I never wanted to be seen by another healthcare provider again. Witnessing patients experience those feelings has transformed my nursing philosophy. Nursing is more than just caring for the physical manifestations of a presenting illness, injury, acute, or chronic disease. It's about caring for and supporting the patient's mental and spiritual health. My philosophy, my why is treating others as I wish to be treated through emotional validation by learning about, understanding, and expressing acceptance of another person's emotional experience. The three professional values, traits, or skills that mean the most in my nursing practice are therapeutic communication, providing compassionate care, and practicing with empathy always. Therapeutic communication creates a safe space, allowing patients to feel at ease and encourages openness and trust. The power of compassionate care lowers stress and anxiety and improves patient physical and mental health outcomes. To practice with empathy is to see, understand, and share another's viewpoint without judgment. It is the cognitive, intentional, and deliberate act of understanding someone else's perspective. To maintain and develop therapeutic communication, I plan to attend conferences and teachings specifically aimed at improving this skill. For example, the American Holistic Nurses Association is holding their 43rd annual conference in 2023 with a focus on changing our healthcare system from a medical model to a more holistic one. This includes strategies in therapeutic communication. To ensure that I always provide compassionate care, I must prevent compassion fatigue. In order to do this, I must be able to recognize signs of compassion fatigue like mood swings, becoming withdrawn, feeling anxious and or depressed, and the inability to provide the best possible care. I must also combat or treat compassion fatigue by focusing on self-care and getting professional help if need be. To ensure that I always practice with empathy, I must prevent empathy burnout. To do this, I must practice self awareness and self care, set clear boundaries for myself, and trust that patients can save themselves. I personally intend to impact society through my nursing by volunteering at free clinics, women's clinics, and family planning clinics. By providing compassionate, empathetic, non judgmental care to underserved, targeted, and attacked individuals in the community, I can help strengthen society's belief that all individuals deserve and have the right to health care. Through volunteer work, I can also encourage individuals to seek care, and I can help build the emotional stability of society as a whole. The two provisions from the ANA Code of Ethics that resonate with me are Provision 1 and Provision 3. Provision 1 relates to my nursing philosophy to treat others as I wish to be treated through emotional validation by speaking to the universal right to individualized, compassionate health care by considering and respecting individual needs and values and setting aside any bias or prejudice. It states that all human beings are worthy of receiving the best care, including care for their emotional well being. Provision 3 relates to my nursing philosophy by focusing on the promotion of patient health and safety. Nurses are obligated to establish and maintain a culture of not just physical safety, but also emotional safety. Additionally, nurses must report inappropriate, unethical physical and emotional treatment of patients. In order to meet these ethical standards, I must recognize and combat compassion fatigue, empathy and emotional burnout, as well as set aside any bias or opinions I might have. Taking a deep breath and centering myself before entering a patient's room allows me to focus solely on them. Additionally, I will ask patients about their goals, values, beliefs, preferences. By doing all this, I will be able to provide individualized, compassionate care while considering and respecting individual needs and values. To promote an environment of emotional safety, I will establish a trusting and open relationship with management to ensure reports of inappropriate, unethical, emotional treatment of patients are taken seriously. I will also invest my time and provide information and evidence to initiate policy changes that support the emotional well being and safety of all patients. One current proposed healthcare bill that relates to my nursing philosophy is Bill S 3073, also known as the Equal Healthcare for All Act. This bill was first introduced to the Senate on October 26, 2021, and is still in the introduction stage of the legislative process. This bill prohibits discrimination in healthcare based on race, religion, and other characteristics. It also revises reporting requirements, adds equity related measures to certain Medicare programs, and makes other changes to reduce healthcare disparities. It requires the Department of Health and Human Services to establish an administrative process to resolve complaints about inequitable healthcare. HHS must also investigate these complaints and mediate agreements to resolve the issues. Additionally, the Centers for Medicare and Medicaid Services must include measures related to equitable health care in the Medicare Value Based Purchasing Program for hospitals. This program provides incentive payments based on the quality of care. This bill also establishes the Federal Health Equity Commission to monitor the implementation of this bill and establishes a grant program for hospitals to promote equitable health care. By advocating for this bill, I support the obligation and demand for healthcare professionals to provide equal physical, emotional, and spiritual care for all, no matter their race, religion, or other characteristics such as values, beliefs, and needs. This supports my nursing philosophy to treat others as I wish to be treated through emotional validation. Additionally, the bill addresses reporting requirements for inequitable care, provides incentive payments based on quality of care, and establishes a grant program for hospitals to promote equitable health care. This will ultimately lead to greater physical, emotional, and spiritual care of patients. I want to close with a call to action. I challenge each of you to treat your patients how you wish to be treated. Provide them with emotional validation, and always practice with compassion and empathy. Thank you.